Save a Smile was founded in June 2003 by Cook Children's and the Children's Oral Health Coalition in Tarrant County. Save a Smile is an innovative, nationally recognized collaborative program dedicated to providing restorative and preventive dental care to low-income children in the community through volunteer dentists. The Save a Smile program exemplifies a unique approach through which Cook Children's brings the resources of extraordinary volunteer dentists to meet the most pressing dental needs of children. With over 14 years of service, Save a Smile has evaluated thousands of local children in many schools and several school districts. The result is millions of dollars in services donated by a vast group of very generous dentists and specialists. And we also want to thank you, the schools, for allowing us to be a guest in your school and screen your students for our program. Save a Smile is a true community collaboration.
Hi, I'm Dr. Tanya Fuqua. I'm the dentist and director for the Save a Smile program. Save a Smile is an invaluable resource for the children in our community and your school. The key component to Save a Smile is having the social services that connect these children to the dental treatment they most desperately need. We need you to partner with Save a Smile to help the children in your school receive comprehensive dental care free of charge, and it starts with the screenings.
Dental screenings are conducted annually for elementary-aged children in participating schools to identify children with current or potential dental problems. The dental screening, also known as a limited oral evaluation, is provided in the schools by licensed volunteer dentists during the fall semester. The law in Texas states we can only screen the children who return a signed consent form. It is extremely important for us all to work together to get the consent form signed and returned by the students. Every child that's screened receives an oral health kit. Because only the children that are screened receive an oral health kit, this is one reason why it's so important that we all try hard to get a signed consent form from each child. We want every child to benefit from getting the tools they need to support good oral health. After the screening is complete, the severity of any dental problems, age of the child, possible language barriers, and financial insurance status is compiled, and a referral is made to the appropriate volunteer dental provider participating in Save a Smile. Volunteer dentists are matched with qualifying patients, and dental care is given in the dentist's private offices, free of charge to the school and families. An important aspect of the Save a Smile program is the social service component. A licensed master social worker is dedicated solely to the Save a Smile program. The social worker manages community health workers who work directly in the schools with the students and their families to determine and assist any social service needs they might have in addition to their dental issues. Each participating school has an assigned community health worker.
Hi, my name is Leah Brown. I'm a licensed clinical social worker and the manager of social services for the Save a Smile program. Save a Smile is a unique program that pairs children and families with private practicing volunteer dentists in the community. What makes us so unique is that we also have a social service component so that we make sure oral health can be a priority and also attainable for our families in the community. We do this providing lots of different resources and referrals to community agencies, as well as providing transportation and translation, for example. If a family needs to get to the dentist, we will take them. If they need help speaking the language, we will provide that service. Additionally, we really want to be a part of your school, and to do that, we can come to health fairs, meet the teacher night, and open houses.
We want your school screening to run as smoothly as possible. Here are some tips and other important information to help us create an efficient screening and decrease the children's time away from the classroom. Save a Smile provides and covers all supplies and forms. There are no incurred costs for the school. We also provide hard copies of the consent form shown on the screen. We are happy to provide as many copies of the form needed to ensure families have multiple opportunities to sign and complete the consent form. We can participate in your school's Meet the Teacher Night so families can begin to learn about the program and meet the community health worker. It also gives us the opportunity to begin getting consent forms signed. Teachers and staff are key to getting consent forms back from students and families. Teachers can encourage participation in the screening by letting the children know they will receive an oral health kit and prize. The school nurse will be most helpful at developing a screening schedule to decrease the amount of time teachers and students are out of the classroom. School nurses know the school schedule best, and we want to be in and out as quickly as possible to decrease disruption of the school day. Screening forms are available in multiple languages, so please let us know if there is a family that may need a form in a specific language. Save a Smile is happy to provide additional copies of the consent form for families to have multiple opportunities to sign and return the form. Please encourage and remind parents to return the signed consent form. Each school has a designated person who collects the consent forms for Save a Smile, so please check with the school nurse or your school social worker to determine who this person is for your school. Help the Save a Smile team identify the best location to hold the dental screening at your school. The area needs to have enough room to bring in 1 to 2 classes at a time, plus hold about 10 to 14 volunteers who are working the screening. We will also need about 4 to 6 chairs, 2 tables, and 2 to 3 trash cans. We have provided the dental screenings in rooms such as a large classroom or computer lab, the library, the gym, or even the auditorium. We can even use the stage in the auditorium. If available, a parent volunteer can be a valuable help on screening day. A parent volunteer can help pick up classes who are running late to the screening, help kids line up, and help kids who weren't able to walk with their class due to late arrival. The teachers will leave the screening with the individual results to send home at the end of the day with each child screened. The school nurse will get final classification results for each child screened per classroom. Thank you for helping to improve the oral health of children in our community. We look forward to seeing you at your school screening.